you know you should begin brushing your baby's very first tooth? Pediatric dentists tell us that most parents do not, and so that leaves lots of little ones at risk for tooth decay.
I can never overemphasize the importance of brushing a baby's teeth. Babies can't brush their own teeth. Parents need to help them. So we spend a considerable amount of time showing parents how to brush the teeth and verifying that they can actually do it in the way that's going to be effective. I show them how to lift the lip and look at the teeth from the front and from the back and just look for plaque. If there's visible plaque on the teeth, if they can see it with their eyes, that child is at high risk for getting early childhood caries.
Look for unusual white spot lesions right at the collars of the teeth, and they should also look for brown spots. I've often heard parents say, I saw those brown spots on the child's teeth, but I didn't know what they were.
On the back one, just go back and forth, back and forth.
What I like to tell the parents is that you need to control how much toothpaste is being put on this child's toothbrush. So just a small pea-sized amount or even a rice grain amount of toothpaste is really all that child will need.
Plaque is like email. You know, your inbox fills up with email and you have to delete it and it keeps filling up. Plaque gets in your teeth, you have to brush it away, it comes back, you have to keep brushing it again. It's a daily event to brush your teeth.
Remember the 2 P's. Be patient with your child, but be persistent with them about it as well. This is something that everybody does. And by doing it as a routine at nighttime, along with bath time, when it is done in this fashion, then children will very quickly get it and not have a problem with brushing.
Babies are often mesmerized if you hum or sing and their mouth is open because they're looking right up at you, and it gives you a great opportunity to get into the mouth and get the teeth brushed. Mom brushes her teeth in front of the baby, and then the baby is more willing to allow you to brush your teeth, or you can help the baby. The baby wants to do it themselves because they just saw mommy or they just saw daddy do it. Another thing is to brush a doll baby's teeth in front of the child. It's called what we call modeling, and you can brush a baby's teeth, and it makes the baby more willing to brush their teeth.
So remember, brushing is a process that you'll need to oversee now and for many years to come. I still help my school-age son, and so far so good, no cavities. It's well worth the time and commitment. Pediatric dentists say education about the early care of the gums and teeth should begin even before the baby arrives. Here's what you need to know about the strong link between a mother's and infant's oral health.
Especially during pregnancy, it is very important for the mother to maintain her own oral health, because it's during that pregnancy time period where the fetus is going to draw a lot of resources out of the mother.
The mom needs to make sure that her oral health is in great shape. You know, she needs to go to the dentist, she needs to get her teeth cleaned, make sure she has no active decay, no cavities.
At first they're going to be very busy and their heads are going to be full. So learning and getting that education early on, and it's a matter of emphasis and reinforcement. So they need to hear that message from their OBs, they need to hear that message from their pediatrician and pediatric dentist. It's a team effort to take care of that baby.
We are here to take care of all of Emmy's needs. I'm here to help you. I'm going to answer all your questions, give you all the guidance I can, but you're the one who's got to do it. You got to be the mom, you got to be the dad, you got to be the parent.
So it's a place that they can call their home, their dental home. And usually pediatric dentists for that age population is the dental home.
I'm so glad that you've brought Emmy at this young age, because now you can consider us being your dental home.
So in other words, what we want the child to be able to do is to come to one place and get all of their dental needs, questions in one facility. That's why we want you to already have established a dental home for your child, so that when an injury occurs, you know immediately who you should call.
Injuries do occur, and they're very, very common. So know that if she injures herself inside her mouth or to her teeth or lips, call us. That's why we want the dental home by age 1, so we can educate the parent what to do, how to clean their teeth. Hi, cutie pie. So you can do this even when she's sitting up like that, because all you're going to do is just take this and just rub inside her mouth.
Our whole office staff is geared towards dealing with kids day in and day out, and so it comes easy and naturally for them as it does for us.
So keep in mind that concept of finding a good dental home for your baby. A solid professional team will help lay the foundation for a lifetime of healthy smiles.